My name is Catherine Dunkley, and this is my professional development interview. Meet Christy Ladowski, Masters of Public Health. Christy's road to public health was not something that initially started in the field of public health. She graduated in 2006 with a Bachelor's of Economics degree. From there, she took an internship with ASIC, a company that brought her to a non-for-profit health company in Nigeria. This is really where her passion for public health was born. Upon her return home to the United States, she enrolled in a Master's of Public Health program at Stony Brook University. From there, upon her completion in 2011, she became a research coordinator and then, following that, a program coordinator for Stony Brook Children's Hospital's Keeping Families Healthy program. She then transitioned to the Injury Prevention and Outreach Coordinator at Stony Brook University Hospital's Level 1 ACS Verified Trauma Center, where she began in 2014. The Injury Prevention Programming at Stony Brook University Hospital, which is located in Suffolk County, New York, which serves a population of 1.4 million people. Specifically, the population that she serves for the injury prevention aspect are older adults, those over the age of 65, or those who are just at a high risk of falling. And through car safety, she focuses on all ages. Her mission statement for her office is to achieve an organized and effective approach to injury prevention in Suffolk County by prioritizing efforts based on local trauma registry and epidemiological data and partnering with injury prevention experts and resources in the community. Some of the programs that Christy offers through the Level 1 Trauma Center include Tai Chi for Arthritis, Stepping On, A Matter of Balance. She is a car fit technician. She is a child passenger safety technician. She offers What Do You Consider Lethal, or Impact Teen Drivers. And she is an AARP Smart Driver course instructor. Several of these programs are what we consider to be evidence-based programming, meaning they have been researched, studied, evaluated, and they are determined to be effective in what they lead. Christy, additionally, is a master trainer in several of these programs as well, meaning that she can train others to work underneath her to deliver the program. That is important in public health because it is expanding the amount of people that one person can have an impact on. Some of the 10 essential public health services that her programming at Stony Brook University Hospital touches on are that they improve, innovate through research and quality improvement, assess and monitor population through injury data at local and state levels, enable equitable access, they build a diverse and skilled workforce, and communicate effectively to inform and educate. The first one, she improves and innovates through research by taking programs such as A Matter of Balance and researching them to focus on different populations. She's currently translating the A Matter of Balance program to be specific for Parkinson's patients. Through this, she is using an IRB to research the effectiveness of this program. She assesses and monitors population data through the use of her local trauma registry, which is located specifically at Stony Brook University Hospital, uses through their Regional Trauma Advisory Committee, which is all of Suffolk County, or the State Trauma Advisory Committee, which is where all of New York State trauma services report to. She enables equitable access to her programs by not charging for any of the programs and making sure that they are placed and offered in locations that are free to access, easy to access, and available to the public, such as her university itself and local libraries and local community centers. She's building a diverse workforce by training others to offer the programs that she offers to expand the reach of the injury prevention programming at Stony Brook University Hospitals. And when she cannot just build the workforce, she's educating and delivering these programs herself. One of the biggest takeaways that I took from her program, from her interview, was that you must maintain and nurture relationships that you build along the way. It's not just in public health, but we must be motivated as people to make as many connections as possible, and we have to value those connections in the short term and the long term. You have to see the value in what others do, and we have to collaborate. We have to collaborate with those that are within our field and those that are not within our field. And lastly, we should never sell ourselves short. Even though we may only be one person doing something, we have to know that we make a difference and that we can be changing the future for others by putting in the best effort we can into our public health programming. Thank you and have a great day.